Download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's daily bulletin. Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Let's look at today's top headlines. The All India Institute of Medical Sciences Bhubaneswar is inviting offline applications for the post of senior residents under Government of India Residency Scheme 1992 for a 10-year period of 3 years. As per the AIIMS notification, there are total 88 vacancies in various departments. The National Consumer Disputes Redressal Commission recently directed the Krishna Institute of Medical Sciences and its doctors to pay Rs 25 lakh compensation to the family of the patient who died frontal hematoma with massive herniation of the brain. After perusing the medical records and medical literature, the Apex Consumer Court opined that the doctors at KIMS Hospital treated the patient only symptomatically and failed to do proper clinical assessment and crucial investigations to find out subarachnoid hemorrhage. NBE nod to Ranchi Sadar Hospital for 4 DNB seats in Obstetrics and Gynaecology. Bringing good news to the postgraduate medical aspirants in Jharkhand, the National Board of Examinations in Medical Sciences has given its permission to Ranchi Sadar Hospital for running Diplomat of National Board course in Obstetrics and Gynaecology.
In cancer patients with neutropenic fever, delaying antibiotic treatment past 60 minutes from the time of fever detection does not reduce the short-term chance of survival, according to a study in the American Journal of Medical Quality. Neutropenia occurs because chemotherapy destroys neutrophils along with tumor cells. A fever in a patient with neutropenia is considered a medical emergency, according to study authors. The fever signals a severe decrease in neutrophils and therefore a compromised ability of the immune system to ward off infections. Neutropenic fever is defined as a temperature of at least 101 degrees or a sustained temperature of at least 100.4 degrees for an hour or more. DNA methylation-based or DNA-M measures of biological aging associate with increased risk of morbidity and mortality, but their links with cognitive decline are less established. In this new study, researchers Rebecca G. Reedland, others from the University of Pittsburgh and the University of California examined changes over a 16-year interval in epigenetic clocks and pace of aging measures in 48 midlife adults enrolled in the longitudinal arm of the Adult Health and Behavior Project selected for discrepant cognitive trajectories. Patients with cancer are known to have increased risk of COVID-19 complications, including death. In a recent study published in JAMA Oncology, the researchers have found that patients with cancer had greater risk of SARS-CoV-2 infection and worse outcomes than patients without cancer, and the risk was highest for patients with hematologic cancer and any patients with cancer receiving active treatment. It was also found that triple vaccination was associated with lower risk of poor outcomes. Reports have shown reduced seroresponse following vaccination in patients with cancer. As such, in this study, the team hypothesized that patients with cancer have worse outcome after vaccination, with greater breakthrough infections and worse COVID-19 outcomes, particularly for patients with hematologic cancer. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.